Hi everyone, today my group will present a topic which is toluene poisoning. My name is Yong Hong Lee. Toluene is a liquid chemical compound which is used in the manufacturing of commercial products such as paint, thinner and glue. And toluene is insoluble in water and colorless. It can be dangerous when its fumes are inhaled. Basically, toluene is made up of benzene ring and methyl group. Methyl group will provide a greater electron releasing properties to the toluene, which make it become more susceptible to the oxidation. And methyl group is more reactive than the benzene ring. Benzene ring is a nucleophile, which means it is rich in the electron, and it acts as intermediate material of the toluene and acts as the functional group of the toluenes. This is a few chemical reaction that can be proceed by the benzene ring to form different type of metabolite. And metabolite of benzene ring can depress bone marrow and cause aplastic anemia. Besides, toluene also can cause different type of neurological damage. And my friend Ashraf will further explain about this in the mechanism of the toluene later. And now I will pass the presentation to my groupmate Zaifa. Thank you.
Thank you, Yong, for the explanations on structures of the toluene. And next, I'm going to present on the role of exposure of toluene. First of all, toluene occurs naturally as a component of crude oil and a major petroaromatic component. Here, we know that petrol that we usually put it inside our cars or motorcycle actually contain the toluene that can cause us poisoning. So if there long term of exposure on the petrol, it may cause us to get a toluene poisoning. Next, it is used in household products such as aerosols, lacquers, rust inhibitors, adhesive and solvent-based cleaning agent. So for those who work as a cleaner, they might have a larger risk to get toluene poisoning. And also, if we use aerosols every day, we also can get a toluene poisoning. And toluene can be exposed to air that polluted from motor exhaust. If there's any air pollutions occur outside our home, make sure we wear a proper attire, a correct attire to prevent us from inhale the toluene that exists inside the polluted air. And then the toluene can be origin from tobacco smoke and unfiltered cigarette. And lastly, it can be found also inside the contaminated food and drink. Here, make sure we choose the correct place or restaurant to eat or to drink. This may help us to prevent from the toluene poisoning. If the restaurant that we're going to eat is clean. So basically, there are 5 routes of exposure of toluene, such as inhalation from the pollution or from the polluted air, from the aerosols, ingestion from the food and drink that contaminate with toluene, and then direct skin contact. When we use the self-adhesive or cleaning agent, we may expose to the we may have the direct contact toward the product. And then the eye contact, such as from aerosols that we spray to the air and going to enter our eye, going to expose to the air that contain the aerosols. And then lastly is the long-term exposure of toluene. That's all from me. Thank you. That I'm going to pass this presentation to John to explain on mechanism of toluene.
Thank you for the presentation just now. So I will continue for my part. Hi everyone, my name is Sherwin. So for today, I will start to explain about mechanism of toluene. Okay, first things first, let's go into absorption. Okay, basically toluene is usually absorbed via respiratory tract, and it usually presents in pain, fingernail polish. It smells nice, so yeah, it's used. It can enter via respiratory tract. When it is absorbed via respiratory tract, it is known as incomplete exposure. It is We can say that it is complete exposure when a patient is accidentally ingested the toluene. Next is about distribution. Toluene is distributed through white adipose tissue, adrenal, kidneys, liver, lungs, and brains. The distribution is related to the blood concentration and brain lipid content of the patient. Next is about metabolism and elimination. Most most of the toluene is metabolized in the liver by conversion to form benzoic acid by enzyme alcohol dehydrogenase and aldehyde dehydrogenase. It can also form benzoglucuronide, and both products is eliminated via kidney in the form of urine. Here I have the pathway for toluene. First things first, when toluene is absorbed, it will be converted into benzyl alcohol, benzyl alcohol, and then benzyl alcohol will be converted into benzaldehyde, continue to be benzoic acid, benzoyl, benzoyl CoA, and then lastly it will become hippuric acid, which will be eliminated in urine. Okay, that's all from me. I will pass this presentation to the next presenter. Thank you.
Hello, Assalamualaikum to my lecturer and my fellow friends. I am Muhammad Ashraf. So I will present about clinical effect on toluene. So that slide is the clinical effect will occur onto five types, which is inhalation, ingestion, direct contact, eye contact, and long-term exposure. So the inhalation, we can see it can irritate the nose and throat. It can harm the nervous system when it becomes severe, when the inhalation of the toluene get into our nervous system. So with the severe part, we can exposure that can cause unconsciousness. So the sign and symptom of the inhalation of toluene is headache, dizziness, drowsiness, and confusion. So for ingestion, it can cause effects same as the inhalation, which is headache and all. Aspiration hazard, severe lung damage if be drawn into the lungs, and may cause death for the overexposure. So direct skin contact, it will cause the skin irritant from moderate to severe, and then can absorb into the skin, may cause effect same as inhalation, just like before. And the sign and symptom of the direct skin contact for toluene is pain, redness, and swelling. For eye contact, it may cause mild irritations, and then long-term exposure can cause dry red dermatitis following skin contact, and can harm to the kidney when it get into our bloodstream. And I think that's all from me. I will pass my presentation to next presenter. Thank you for listening.
Thank you, Ashraf. Assalamu alaikum. I am Munira binti Zuhairi. So I will continue this presentation with the management of toluene poison. In the management of toluene poison, I am going to present to you about how to handle the toluene poison, how to store the toluene poison, and if there is any emergency cases related to toluene poison, how to handle with the situation. In the handling, we must handle the toluene poison in a properly ventilated area to avoid any accidental inhalations of toluene vapors. Avoid to handle the toluene chemical in a small room to avoid any suffocation. Second, please practice your personal protective equipment or PPE. by wearing suitable respiratory equipment such as masks and protective clothing such as laboratory coat. Avoid contact with the skin and eyes directly by wearing gloves and goggles. Never use toluene near the sources of heat or ignition, as the toluene is a flammable chemical. If there is any toluene leakage or spill, do not panic. Exit the area immediately by using emergency route. Be sure that you have eliminated all the toluene chemicals by the heat and ignition sources, such as sparks and open flames. As I mentioned before, because toluene chemical is a flammable chemical. Next, I will continue on how to store the toluene poison. Firstly, keep the toluene away from the sources of heat or ignition and direct sunlight, as well as incompatible material like oxidizing agent. Because if there is any interaction between the toluene poison and flammable sources, it might cause fire. Store the toluene in a tightly closed container in a dry, well-ventilated and preferably container designed for the storage of flammable liquid. Store the toluene poison at a minimal level or amount. For further reading, I provide you a piece of safety data sheet on a precaution and first aid, as well as a hazard identification on classifications of the substances or mixture, and there are also a hazard warning that we usually saw at the level of the container of toluene. And there is further information on handling and storage of toluene poison on a safety data sheet. Then I will continue on how to handle an emergency situation related to toluene poison. Firstly, emergency call. Remember to call 911 or local emergency help number immediately for emergency assistance. Call the Poison Control Center or Pusat Racun Negara on the number as stated in the slide, or visit their website on further instruction. While calling them, if possible, provide them with information on the compound taken by the victim, quantity and time of injection, the age, weight, and general health status of affected individual. Carefully remove the affected individual from the exposure area. Confirm that the affected individual areas are protected. Ensure their breathing and the presence of the pulse. There are several routes of exposure as mentioned by Huzaifa before. Firstly, if the affected individual accidentally inhaled the toluene vapor, move the affected individual to the fresh air immediately. Administer oxygen if breathing is difficult, and use artificial respiration if the affected individual not breathing. For sure, seek medical attention for further treatment. Secondly, if the victim accidentally ingests the toluene poison, do not induce vomiting. Call medical professional immediately, especially if large amount of toluene poison has been swallowed. Help the affected individual by rinse their mouth with water. If the vomit is occur naturally, help them by lean their body forward to reduce the risk of aspiration. Then, rinse their mouth with water again. Immediately call poison center or doctor. Immediately give milk or water to the affected individuals to drink. If the affected individual having difficulty in breathing and swallowing, including vomiting or decreased alertness, do not give anything by their mouth. Take individual immediately to the emergency room for further treatment and try to take the compound bottle or container to the emergency room. Thirdly, if the skins of affected individual directly contact with the toluene poison, immediately flush the skin with plenty of water and cover the irritated skin with the antibacterial cream. Wash the skin thoroughly with the lukewarm and gently flowing with non-abrasive soap water for about 15 to 20 minutes. Immediately take off the contaminated clothing, shoes, and leather goods. Quickly and gently brush away the excess chemical. If the affected individual eyes contact directly with the toluene poison, quickly and gently blot or brush the chemical off the eyes and faces. Immediately flush the contaminated eyes with lukewarm and gently flowing water for about 15 minutes while holding the eyelids open. If irritations or pain persist, please seek for medical attention. Lastly, I provide you a Toluene's safety data sheet on precaution set on how to handle toluene poison, first aid measures on after inhalation, after skin contact, after eye contact, and after ingestion of toluene poison. So here are some references that we refer on, and I think that's all from us. Thank you, Assalamualaikum, and goodbye.